upon progression, it's a reflection of what was received before. In the first-line FOLFOX bevacizumab, if you moved on to FOLFIRI and a VEGF inhibitor of your choice, ramucirumab, Zaltrap, or even bevacizumab, upon progression in that circumstance, a common approach would be possibly recycling the oxaliplatin. If there was not a progression disease from the oxaliplatin, it was dropped for the neuropathy, which was in this case, which is a practical approach. Many today perhaps may consider a molecular analysis, such as a Guardian, to see if there's actionable targets, or perhaps to determine a more effective therapeutic approach for that individual patient. Of course, there's the new agent, which is likely to be approved pretty soon, TAS-102. There's regorafenib, of course, Stivarga, which has activity. And of course, many clinical trials in this third, fourth line setting, trying to improve on the therapeutic approach there in the fourth line setting. And the interesting part about fourth line is the fact that these patients with stage 4 colorectal cancer are still alive with very good performance status, reasonably good quality of life even at that time frame, unlike many other diseases. And they really can qualify potentially for clinical trials or additional therapy, which may benefit these patients. So multiple clinical trials of interest here. There's clinical trials involving regorafenib plus minus stem cell agents like Boston Biomedical 608, which targets the features of the cancer-initiating stem cell, STAT2/3 pathway. There's regorafenib plus minus ruxolitinib, which is a JAK2 inhibitor. And again, JAK1/2 pathways and inflammation are very critical for a subset of colorectal cancer. And again, based on phase 2 and preclinical data, this may be an interesting approach as well. There's just too many actually agents to name, too many clinical trials to name in this sort of salvage setting. And the question has always been what agent to pair it with. And given that TAS-102 is likely to be approved, many clinical trials may probably start up with TAS-102 in combination with a new agent.